the deep tissue and the holistic pelvic care that you guys do with the tools that you use. I know that you brought the what's it called?
The Thermiva
Thermiva, thank you.
and the
Sorry.
MLT. Yeah.
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 Yeah. Can we talk about that stuff and how that works?
Mm-hmm. I'll start with the devices. So the Thermiva, this is the instrument that we use. It uses radio frequency, which basically is heat.
Mm-hmm.
And similar to when you get ultrasound and they use gel, we use the transducer here at the end and gel internally. So you can do an internal and an external treatment. And you bring heat to the tissues to basically recruit collagen building. That's your body's response to the heat. It's
so
really
cool.
helpful for incontinence, for if people are have had lots of babies and pregnancies, and there's just like laxity to their tissues. It can help grade 1 and 2 prolapse. So if you have bladder or uterine or rectal prolapse often after having babies as well, it can help kind of strengthen the structural support for those organs internally in the vaginal canal.
That's so cool.
That treatment there's no downtime following the treatment itself. You can come in and go home the same night and have sex that night, or go about your day, go exercise, take a shower. Like everything is pretty much the same. So we do treat internally in the vaginal canal, like top and bottom, and then externally on both sides of the labia and clitoral hood. You can also do like perineal if there's issues there. That treatment doesn't have any numbing cream or anything like that. You're in office. The total treatment time is usually about 30 minutes for that one.
That's not bad at all.
And then we do 3 treatments 4 weeks apart.
Okay.
And that's when we see the most benefit is when we hit those intervals. And then you do like 1 a year maintenance kind of treatment.
Yeah.
So rad.
People also talked about like their libido going up
Mm-hmm.
with that, especially with, like women who are postmenopausal. Sometimes the tissue around the clitoris is, thins a little bit.
Yeah.
And again, bringing blood flow to that area really does enhance the sexual experience.
Huge difference, I bet.
And it helps with lubrication in the vaginal canal too.
Okay.
Yeah.
And this is the one that is good for people who don't want to do hormone treatments in order to boost that collagen, right? I'm trying to put the
they both are.
Okay.
Both of them. So this one we think of a little bit more, I tend to think of it a little bit more in like maybe the little younger crowd and people who have a little bit more thinner muscles or like weaker muscles, and we want to help like support all that building.
Got it.
We have also used this in conjunction with the other device, which I can chat about in a minute. And we've also used this in people maybe who can't tolerate the other device, because I'll show you that one next. It's a little bigger. So this is the internal probe. Excuse me. It's a CO2 laser. So this gets attached to the laser, and then there's a mirror on the end that reflects, so nothing's going to hit like cervix or anything like that. The big difference, obviously the size difference is one piece of it.
Yes, ma'am.
Yeah.
Uh-huh.
And this uses gel.
Yeah.
Oh, right.
This
That's what you're saying.
has to go in dry because it'll interfere with the firing of the laser.
Oh.
So you can't come and receive this treatment if you're on your period or things like that
Got
too.
it.
So for some people who are maybe 5 or 10 years postmenopausal and they have had that atrophy and that like shrinking of the tissue, this, while would be the better choice treatment wise, they might not be able to tolerate that at first. So we'll start building some of that elasticity by doing a couple of those treatments until we get a little more comfort.
Baby step into.
Yeah, and then this We do use numbing cream externally on the tissue. It wears off within a few hours. It's not, you're not like going to the dentist. You're not going to be numb all day.
Good to know.
And same thing, we do an internal treatment with this probe and then external with this one. And this is just so we get the right distance from the tissue for the laser to fire. That treatment in office is a lot quicker. It's like maybe 15 minutes at the most. But we can treat a lot of the same areas. Obviously, internally, external labia. We can treat the perineum and the introitus, which is just the vaginal opening. Mm-hmm. What we can't treat with the laser is clitoral hood. So if people are having decreased sensation or arousal issues or things like that, we will do the two treatments together. So we can use this for the deeper tissue collagen recruitment, and then use this just over clitoral hood to help circulation and collagen building there.
Magical tools.
Yeah. And in combination with hormones, in combination with the pelvic floor work that we've already talked about, it really, really makes a huge difference in people's lives.
Hey guys, thanks for checking out the short clips that are a part of the full podcast that I was lucky enough to do with Dr. Lisa Dickinson and Dr. Meghan Bennett with Amber Wellness Group. The podcast was on women's pelvic floor health, and the amount of information that I learned from these ladies is unreal. So please, 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 if you have a vagina, check out the full episode. The link is below. And also, I want you guys to know that the reason I'm doing this is to build a community. We all have a vagina. We all go through shit that 9 times out of 10 we don't want to talk about. We don't want to go to the doctor. We don't want to look into what we need to do. And I want to be able to build a community where we have those conversations and where we get those questions answered. So if you are going through anything, know that this is a safe space. I would love for you to comment below what I can potentially help figure out in the future. I'm going to be doing podcast episodes with lots of different specialists and doctors. I also now am lucky enough to have access to maybe just get the answer to the question that you need. So please let me know if there's anything that this brings up for you, because all of us are going through our own shit and we don't have to go through it alone. If we haven't gone through it, we probably will, or we know somebody who has. So having that conversation and dealing with these things together is really the reason why I'm here. So like, comment, subscribe, and I hope to see you soon.